Hello, everyone. Welcome to the launch of this incredible report from the, excuse me, the Global Health and Climate Alliance, Cradle to Grave, the Health Toll of Fossil Fuels and the Imperative for a Just Transition. I'm Amy Westervelt. I run a project called Drilled. We do a podcast and a website, lots of climate reporting. And I have to say, as someone who's been, you know, digging into and reading about and looking at this stuff for a long time, I think this is the most comprehensive report I've seen on all of the health impacts of the fossil fuel supply chain. So, a little bit of housekeeping before we start here. We're here to discuss this report. We're going to talk a little bit about the findings and where do we go from there. We're going to start with a panel discussion, then we're going to watch a couple of videos, then we're going to come back to the panel and talk a little bit more. Interpretation is available in Spanish, French, and Portuguese. We do have a Q&A function here, so please drop your questions in there as we go, and we'll try to get to those questions. If we don't get to all of them, then maybe the folks at the Alliance can figure out a way to answer those in another way. So with that, I'm pleased to introduce Dr. Jenny Miller from the Global Climate and Health Alliance to give us a little bit of intro to this report.
Thanks so much, Amy. So yes, as Amy just mentioned, I'm Jenny Miller. I'm the Executive Director of the Global Climate and Health Alliance. And we're really, really pleased to have all of you here with us today for the launch of this report, Cradle to Grave, the Health Toll of Fossil Fuels and the Imperative for a Just Transition. Next slide, please. So the Global Climate and Health Alliance is an alliance of health organizations from around the world that come together and work together to bring a health perspective and a health voice into the climate conversation in order to drive more ambitious climate action and climate solutions that protect and promote people's health in the climate era. Between our member organizations and our formal partners, we're a network that represents over 46 million health workers from around the world, from over 125 countries. So why did we write this report? Last year, CO2 emissions reached a new record high, a 0.8% increase from the previous year at a time when we need to be dramatically decreasing greenhouse gas emissions. And we're seeing the toll of climate change all around us every day with extreme heat events, wildfires that distribute toxic wildfire smoke to cities and towns hundreds and even thousands of miles away, extreme storms, infectious diseases, and all of those impacts are affecting the patients and communities that we as the health community serve. So in the health community, we see what's happening with our patients and our communities. But at the same time, even though we see those impacts, many of the harms of the root driver of climate change are actually not widely recognized. What we found in writing this report is that there is abundant evidence of the health harms of fossil fuels. At the same time, there remain some evidence gaps. There are geographies where there's not localized data. There are ways in which the connections between different types of harm are not being made. Next slide, please. So in this report, we set out to take a look at what are the toxins and pollutants that are produced at each stage of the fossil fuel production process. We also wanted to understand when and how the human body is impacted by fossil fuel pollution. And we wanted to take a look at, how those risks compound, which communities are most vulnerable, most exposed, and how do those things add up to the impacts that we see. We took a look at, did a kind of a global review of the peer-reviewed evidence and did our best to bring all of that together in a comprehensive way. But we also felt like it was important to bring this data to life. So we included case studies and personal testimonies, including a few testimonies from people living in frontline communities. We wanted to make sure that we'd gotten it right, so we had it reviewed by several experts from medicine, public health, toxicology, public policy, law, and we're very grateful to the folks that took the time to review this report for us. Next slide, please. So what did we find? It turns out that fossil fuels negatively impact human health at every stage of their life cycle, from exploration and extraction all the way to disposal. So I think the most common understanding of the ways in which fossil fuels harm our health is people think about air pollution. When we burn fossil fuels through, in our vehicles to produce electricity, that produces air pollution, and many of us are quite well aware of the health impacts of air pollution. But every stage of the fossil fuel production cycle, extraction, transporting, spills and leaks during transportation, at every stage there are impacts. And just as one example, children who were in utero that were born to parents who lived near a fracking well had more than twice the odds of developing acute lymphoblastic leukemia as children born to parents living further away from that fracking well. Just one example of many. Next slide, please. So again, when we think about air pollution, people generally think, oh, lung disease, respiratory illness, but toxins from fossil fuels can harm every part of our body. We learned about chemicals that accumulate and persist in the soil and the water, like lead and mercury, which many of us are familiar with, the PFAS, the so-called forever chemicals that we're learning more and more about. They persist in the soil and in the food chain, and accumulate in our bodies. In addition, we think of breathing in fossil fuel pollution, but we also take it in when water is contaminated or it's in the food chain through ingesting, eating, or drinking it, and through our skin. With air pollution, we think of respiratory illness. Particulate matter actually penetrates deep into the bloodstream and can cause heart disease, heart attacks, and stroke. Something that was pervasive throughout this report, throughout the evidence that we took a look at, is cancer. So again, we often think of lung cancer from air pollution, but we found mouth cancer, skin cancer, stomach cancer, kidney, thyroid, prostate, bladder, colon cancer, all associated with exposure to fossil fuel pollution. Next slide, please. We were interested in how fossil fuel pollutants affected people at different stages of the human life cycle as well. And there are impacts at every stage. They look a little bit different. For me, the most heartbreaking one is prenatal exposure. So I mentioned previously the increase in leukemia from babies exposed in utero to fossil fuel pollution. We also see preterm birth, low birth weight, and congenital birth defects, including spina bifida, heart defects. So before a baby is even born, it is saddled with health impacts from fossil fuel pollution that that child will carry with it throughout the rest of its life before it's even born. In early childhood, when children's bodies are growing and developing, again, we see developmental impacts in addition to asthma and childhood cancers. Interestingly, at the other end of the spectrum, in old age, fossil fuel pollution, particularly particulate matter and other air pollutants, contribute to cognitive decline and the risk of dementia. Now, I mentioned at the beginning that we found some gaps in the evidence. One of those gaps that was quite surprising is adolescence. So adolescence, like early childhood, is another phase of human development where there's a lot of change going on in the body as puberty hits and new aspects of one's physical being are coming online. But the evidence is quite limited. We didn't find a lot of research looking at the impacts of fossil fuels on adolescents that are living near fossil fuel facilities. We think that's an important gap. And then in adulthood, adults are most likely to be actually workers in fossil fuel facilities and exposed at much higher levels to some of the toxic pollutants and risk of injury and so forth. Next slide, please. So two things are important to emphasize. The first is that none of us are spared. Over 99, according to the World Health Organization, over 99% of the world's population lives in places that do not meet WHO air pollution standards. PFAS that I mentioned previously are abundant in the environment. Microplastics, which are produced from fossil fuels, are also abundant in our environment. All of us are being exposed. My cook stove in my house, which is a gas cook stove, it leaks methane and toxic co-pollutants as it's delivering my cooking gas. At the same time, there are communities that are far more heavily impacted, and that aligns with poverty, racial discrimination, lack of political power, and a host of other challenges that communities face that mean they're more likely to have that fossil fuel facility placed in their community. And once the fossil fuel facility is in their community, they don't have the economic resources to move or make a change. They may lack access to healthcare. They may lack political power and protection to be able to demand cleaner functioning of the facility. And in a term that I just find wrenching, some of the most impacted communities have come to be called sacrifice zones, as though it's okay to sacrifice certain communities and expose them and saddle them with these high rates of respiratory disease, cancer, heart disease, et cetera, in order for the rest of us to keep using fossil fuels. Next slide, please. And unfortunately, what we also found in the evidence is that the fossil fuel industry does not have a good track record for how it runs its businesses. We found evidence of displacement, land rights violations, human rights violations, exploiting loose environmental and labor laws and advocating to loosen environmental and labor laws. And the promise of economic benefit that is often made when facilities are being proposed just often doesn't prove to pan out. Instead, we found increases in substance abuse, violence, domestic violence, mental health issues in communities that are near fossil fuel facilities. Next slide, please. So I think Amy made reference to this being a quite comprehensive report. We were really struck by the scope and scale and the depth and breadth of the impacts of fossil fuels on people's health around the world, in facilities around the world. And that's all quite heavy news. There's a lot of harm being done. But what this signals to me is a tremendous opportunity. There are proven solutions. Renewables are getting cheaper. Battery technology is getting better. Electric vehicle technology is getting better, and we now have buses and trucks as well as individual vehicles. Regenerative agriculture is building the capacity to grow foods without the inputs of fossil fuel-based fertilizers and pesticides. These are affordable, they're scalable, and in the communities where these solutions are being rolled out, those communities are experiencing cleaner air, energy resilience, healthier landscapes and ecosystems. Secondly, our research found that finances exist, they're just being misdirected. At the moment, the fossil fuel industry is being subsidized with public resources to the tune of 1.3 trillion US dollars in direct, explicit fossil fuel subsidies. If that $1.3 trillion were redirected to clean energy and other solutions, those solutions would rapidly be able to scale. And then finally, we're also indirectly subsidizing the fossil fuel industry by having governments, families, communities take on and shoulder the cost of all of the health impacts that I was just talking about, and the social impacts and the cleanup of polluted areas and so forth. Those indirect fossil fuel subsidies amount to $5.7 trillion. If the industry were called upon to cover the cost of those impacts that it has, that $5.7 trillion could be freed up for health, education, and other social benefits. Next slide, please. So with that quick overview of this report, I invite you to go to our website where you'll find the full report in English, Spanish, French, and Portuguese, as well as other resources. Go there, take a look at the report. We'd be delighted for you to come back with questions and engage with us about it. And now I'm really excited to have the opportunity to turn back to Amy and hear from our distinguished panelists their thoughts on some of the issues raised by this report. Thank you.
Thanks, Jenny. We have a really amazing panel today. I'm just gonna rattle off their bios real quick, and these don't even do them justice. They're all kind of superstars. Okay, so we have Dr. Courtney Howard. Dr. Howard is an emergency physician based in Canada's subarctic and a clinical associate professor at the University of Calgary, known for her leadership in planetary health and advocacy on issues ranging from clean energy to eco-anxiety and wildfires. As chair of the Global Climate and Health Alliance, she combines clinical insight with environmental advocacy to champion health-centered climate policy and justice. Nemo Bassi, I feel like needs no introduction, but I'll give the bio anyway, is a Nigerian architect, environmental activist, author, and poet, amazing poet, who leads the Health of Mother Earth Foundation, Home F, an ecological think tank advancing environmental justice and climate advocacy. He's a former chair of Friends of the Earth International and executive director of Environmental Rights Action, and has been widely recognized for his leadership, receiving honors like Times Hero of the Environment, the Right Livelihood Award, and the Rafto Prize, along with honorary doctorates from the University of York and York University, Canada. Dr. Excuse me. Dr. Maria Nera is a Spanish physician and international health leader and the former director of the Department of Public Health, Environment, and Social Determinants of Health at the World Health Organization. She began her career providing frontline medical care with Médecins Sans Frontières and has held significant public health roles in Spain and within the WHO, earning prestigious distinctions such as France's, oh gosh, you're going to really test my French, my high school French this morning, Médaille de l'Ordre National du Mérite, and being named among the top global influencers in climate and health policy. Then we have Professor Elisa Morgera, who's an Italian legal scholar teaching global environmental law at the University of Strathclyde, where she also directs the One Ocean Hub, a transdisciplinary research initiative on oceans, equity, and environmental justice. In 2024, Professor Morgera was appointed by the UN Human Rights Council as the special rapporteur on the promotion and protection of human rights in the context of climate change, becoming the first Scotland-based expert in any UN thematic mandate. And finally, we have Bobby Peake, who's the director of Groundwork, Friends of the Earth South Africa, and a longstanding environmental justice activist for over 3 decades. Bobby has worked alongside fence line communities resisting fossil fuel extraction and toxic pollution in South Africa and beyond. He's also a Goldman Environmental Prize laureate and serves on South Africa's Presidential Climate Commission, bringing community voices into national climate policy. He's recognized globally for advancing grassroots struggles for environmental health, justice, and a just transition. Welcome, everyone. Thank you for being here. I feel not worthy. Okay, so Dr. Howard, we're going to start with you. This report really shows that fossil fuel harms manifest across every stage of life and across every stage of the fossil fuel extraction and consumption process. So, as someone who is in the ER or the clinic, what do these harms actually look like in real patients? What are you seeing up close in a medical context? And how can health professionals use those frontline experiences to maybe influence the wider political debate on climate?
Thank you. So, as an emergency physician in Canada, I am licensed through the Canadian College of Family Practice. So, one of our actual professional responsibilities is to advocate for healthy public policy on behalf of our patients. So, when I moved to the subarctic 14 years ago, I actually had lunch with Elder Francois Paulette, who at the time was the head of the Elders Council at my hospital. This is a majority Indigenous territory in the subarctic. And he said he was really worried about the local health impacts of the oil sands downstream or upstream from where he lives in Fort Smith. And he asked me if I knew of any research that showed whether or not it was increasing cancer rates. And so I did a literature review. I actually found almost nothing. And what it showed me is that even in a democratic, high income country like Canada with excellent biomedical research capacity, sometimes Indigenous peoples, we know structural disadvantages have led to disproportionate health harms in many different ways for Indigenous peoples on the land we call Canada. There's been structural problems accessing the medical system, problems with governance that make it difficult for them to achieve enough power to get in front of decision makers to say, hey, do a decent study. So, 14 years later, yesterday in the Canadian Medical Association Journal, we finally had a commentary published saying, hey, we need to do more research into the local health impacts of oil sands. So sometimes our responsibility actually extends to the public health aspects. In terms of what I've seen at the bedside, the most memorable patient was we had a brief period when there was fracking in the territory, and someone came in who'd had fracking fluid basically sprayed on him by accident. And so we went through this process where he had a number we were supposed to call to figure out what was in the fracking fluid. So we called this number, spoke with a faceless human who actually wasn't able to tell us what was in there. So now we had a toxic exposure to a worker who was worried. He'd been wearing protective gear. But as an emergency physician, usually people come in with a toxic exposure. They say, "Oh, I took 50 Tylenol," and then you have clear toxic data. You look it up. There's a protocol for it, and you're able to properly treat and reassure somebody. That was not the case in this situation, and we all found it quite upsetting. Fracking is not something that happens in my territory now, but I know that this is something health professionals deal with in other places, and so really problems with data availability, problems with transparency of data, the influence of the industry on decision makers and on the research that does come to light. These are things that have been quite important in my life as a community-based physician here in the North.
That's fascinating and also shocking that it's so early in the research phase still. Okay, Mr. Bassi, I would love to hear from you about what these cradle to grave impacts look like in the Niger Delta. What have you seen?
Well, thank you so much for this conversation and for this wonderful report that's being formally presented today. I'm speaking from the Niger Delta. In fact, I'm staying in the oil capital of Nigeria, the seat of pollution. And sometimes we say that we are in a location that is among the most contaminated by fossil fuel pollutants in the world. And, and so over here, the air we breathe is loaded with contaminants from the oil sector. And, the waters are hugely contaminated. We've got reports that validated this, the United Nations Environment Program report of the assessment of good environment in August 20, in almost all the water bodies in Ogoniland. It also showed that in some places, this pollution had gone into the soil. Time passes. And, recently we had another report from Bayelsa State, one of the states in the United States, with a very alarming level of pollution. In fact, the report was titled Environmental Genocide, a True Cost of Oil, in that region, in the world. And so when we look at the health impact of fossil fuels, it really, really adds to what the true cost of fossil fuel really is. And in the climate conversation, sometimes, as the report noted, all the attention is focused on carbon dioxide. Now we focus also on methane, but people don't what does not want to recognize that this is happening. And this is where all the climate debt is being piled up. Recently, an organization here in the Niger Delta working on women issues conducted blood tests for over 80 women living where the first commercial oil well was drilled in Nigeria 70 years, literally 70 years ago. And they found that every single sample had very high levels of hydrocarbon. I mean, having hydrocarbon in your blood is something that is really scary. But then the Bayelsa State Oil and Environment Report also showed that in some samples that were taken, there were total hydrocarbons at a level 1 million times above safe standards. So we are the living sacrifice. That's where we're the living long sacrifice. That's where I captured this in my poem. We thought it was oil, but it was blood. And, life expectancy is extremely low. Women are turning menopause in their 30s, in their late 20s. And in fact, when it comes to mortality, the biggest festivals we have here are usually funeral festivals because people are just dropping regularly. So the health impact is enormous, it's scary, and we are campaigning continuously for these horrors to stop. But we have a lot of things to contend with, and this kind of global presentation of this report would add power, would add energy to our struggles.
That's such a important point that these are harms that are happening now and have been happening, not some future issue with climate change. Horrific story. So, Dr. Nara, you have been working on championing air pollution as a global health priority and working with a lot of policymakers, the WHO. In that work, what have you seen, looking back? What do you think were the biggest hurdles in making the broader case that fossil fuel phase out itself actually belongs in conversations about health policy?
Thank you. And first of all, let me really congratulate the Global Alliance on Climate Change and Health for this amazing report and all the authors. And it's once again a very powerful one with very, very strong scientific evidence, the type of reports that will allow us to say no excuses once again, no excuses. I think we started a long time ago with the World Health Organization trying to make sure that everybody will understand the consequences of climate change, the consequences of pollution, the consequences of still using fossil fuels, making sure that nobody will be able to say, I didn't know. And I think we reached that point a long time ago with the resolutions at the World Health Assembly, where you have all the ministers of health present, with the different plan of actions, with attending the COPs, the health aids at the COPs, creating different networks, bringing all the health sector to communicate strongly and to pass the messages. I think it's time now for the health community at large, and when I say at large, I include architects as well, and anyone joining and concerned about their health. It's time to be a little bit more, maybe more proactive on our way to communicate, and this report is amazing for that, for several reasons. One, we have already the scientific evidence, and we are all witnesses how this is impacting our health, not only now, but it will be on the future. Second, we have very powerful political and economic arguments reminding us that accelerating this transition to renewable, clean, not polluting sources of energy are good for our society. If you don't want to discuss about climate change, if you don't want to discuss about CO2 emissions, discuss about the health of the people. And those are the arguments that now nobody can disagree on it. Nobody will be able to find the arguments to say, no, it's not affecting our health. You can discuss as much as you want on how do you want your economy to grow, how much you want to continue with extraction of fossil fuels, and this will be the prerogative of governments and ministries of energy and others, but there is something that everybody has to be conscious and have it in front of their political decisions. This is affecting our health. And the most positive and powerful part, if you take the right decisions, if you accelerate this transition, you will be doing so well to your health. So all the issues we had in the past are related to tobacco, for instance, where we have obviously commercial interest from the tobacco industry trying to stop WHO and going beyond and not signing the Framework Convention on Tobacco. We are having it now, of course, for fossil fuels. The difference, the big difference, because in the past I used to say that fossil fuels are the new tobacco, but unfortunately this is worse than the new tobacco, because the commercial interests are coming from different fronts, not only one industry, and we are playing as well with the fact that still many citizens and general members of the society, they might not understand that this is not just an environmental issue that might put at risk their economic development as a country, which is the argument that they are using, I'm sure in Nigeria, they are using everywhere. People need to understand that not only that is not true, because you can have a fantastic economic development and still reduce your pollution, but it's affecting your health now, the health and intelligence and the neurodevelopment of our children, our society. And this is something that nobody can argue against. So we need to align ourselves as a health community on a positive movement, on bringing again the arguments of we want to protect our health, and this is what can be done. And I think this report provides very common sense, very pragmatic, very even economic recommendations. So no way to keep using the economic argument to stop this. We need to advance, and health can be this powerful, motivating argument to go for more and to make sure that the politicians will have it in front of them, and then they will not have excuses to say, I didn't know. Thank you.
Thank you. I wonder if this is a really good counter argument to the energy poverty argument that people are making. It sounds like, that, yeah, okay, people need access to energy, but they also need basic health, right? That's also important. Okay, Professor Morgera. It's hard because I can't see you guys. There you are. You recently did a report on defossilizing economies and talked a lot about the human rights component of that. I'm curious to get your take on how this report helps to further kind of make the case for human rights being a big part of defossilizing economies.
Yeah, no, thank you so much. And again, also from my side, huge congratulations for a groundbreaking report. that indeed shows that not only climate science has now indicated for a while that fossil fuels are the main cause of climate change, but they're also the cause of a very unhealthy, if not harmful, global economic model. And I think that point that Maria just made about all of us realizing whether we've been lucky enough never to experience extreme climate events in our lives, that we're all being affected right here, right now, in every single organ of our body. And that may be because of being exposed to fossil fuel operations or pollution, exposed to air pollution, but also exposed to plastics or even petrochemical products, which are still derived from fossil fuels, and they're harming our food systems. And so all these connections to fossil fuel shows that not only there are multiple forms of harms to the climate, also harming our nature, including in our food systems, means that nature can contribute to regulate the climate system, and that makes climate change worse. But crucially, in every aspect of how we are harmed in our health and how nature is harmed means the human resilience to climate change is diminishing. So to me, this evidence of the health shows that we're all concerned with the climate issues, even if we might not see it or understand it in our everyday experience. And unfortunately, that logic of sacrifice zones, which is also being highlighted in the report, is really crucial, because that's one way to keep many people who are, again, lucky enough to not live in sacrifice zones to think that they're safe, that fossil fuels are not that bad. But in fact, we have now very clear evidence from all the natural sciences and from all the range of health sciences showing that fossil fuels are the root cause of all the planetary crises we're facing, of climate change, of nature loss, of toxic pollution. And on top of this, they're also linked to the crisis of economic inequality. And so on that point, you also raised, Amy, around, energy poverty, costs of living. Very often, because of the subsidies going into our prices for fossil fuels, we don't realize that over decades, fossil fuels have not decreased energy poverty. We still have such a significant number of people without energy, and because of that, they are negatively impacted on their health and a number of human rights. But also our cost of living are going up because fossil fuels are expensive. They're not economically viable, even being so heavily subsidized. And on top of that, they're very insecure. Whereas renewables are by now cheaper, they're more secure, they can be locally sourced. They can also contribute to households and communities shaping what their energy needs are and how they can be responded even in rural areas or underdeserved areas. And so to me, this evidence base, which I've brought also into my report on defossilization, shows clearly that if we look at how our bodies are, clearly defossilizing, so phasing out fossil fuels, should be the priority climate action. And often we can't even mention that, not even in climate negotiations. But secondly, this is not just about defossilizing our energy sector. It's getting rid of fossil fuel across the health sector, the food system sector, and realizing that every phase of fossil fuels is harmful to us. And this has now been even clarified by the International Court of Justice. I saw one of our listeners has mentioned that the International Court of Justice has made a groundbreaking clarification saying that the extraction, the consumption, the licensing of new exploration for fossil fuels and subsidies are illegally internationally. Of course, this depends on which country and for how long they've been using them. But of course, legally and scientifically, there is no doubt that we must prioritize the defossilization of our economies for our own, everyone's well-being right here and right now.
Awesome. Okay, Mr. Peak, a couple people now have talked about frontline communities, and I'm curious to hear from your experience what these impacts look like in the communities that you're working in, and also what the world can learn from these communities in terms of what we should be paying attention to.
Amy, I think Bobby has dropped out.
Oh
I'm just going to
no, we lost
yeah,
him.
Yeah, he was here, but looks like he's not here
Uh-oh.
currently. Let me just text him. Bobby is back. Bobby is back.
He's back. Okay, amazing. Hi, Bobby. I was hoping you could talk to us a little bit about how these issues that we've been hearing about this morning are turning up in the communities that you're working with, and how those communities can teach us lessons about what we should be paying attention to, and what's at stake if we don't.
Amy, let's move on, and I'll
Okay.
just as soon as Bobby
Hopefully.
gets he'll be
Yeah.
back.
Okay, great. Hopefully we'll get him back here soon. All right, with that, we're gonna transition to a couple of videos here and then come back together and talk about where we go from here. We have all this information, what do we do with it now? So first, we're going to see a video from Professor Laurence Toubiana, who's CEO of the European Climate Foundation and a professor at Sciences Po in Paris, and one of the key architects of the Paris Agreement, about the urgency of health-centered climate action at COP30, which is coming up in November. And then we'll see a video from Dr. Jamila Mahmood, a Malaysian medical professional and executive director of the Sunway Center for Planetary Health at Sunway University in Malaysia, about the health community's role in a just transition. So here we go. Take it away, Shweta.
Yeah, and Bobby is back, so maybe we can post
Hi,
the
Bobby.
question that after the video, okay?
Okay, perfect.
We're not hearing the sound at the moment.
Human health, which anyway, all the people who are living through around any exploration and use of fossil fuel knows that. At every stage of life and at every stage of the fossil fuel cycle, the evidence is clear. Low birth weight and defects in the womb, asthma, cancer, heart disease, and dementia later in life. Fossil fuel are leaving a permanent mark on our bodies, our families, our society, and the harms are not even shared equally. Communities on the front line, workers, indigenous people, low-income families, are bearing the heaviest burden of pollution and ill health. The economic cost is enormous. In 2022, fossil fuel subsidy reached $7 trillion, according to the International Monetary Fund. Returning even part of this could prevent millions of premature deaths, ease the strain on our health systems, and accelerate the shift to clean energy. This is why health must be at the center of our climate response. The Paris Agreement, now 10 years old, was about safeguarding a livable future. At COP30 in Belém, government will be judged on whether they are ready to confront fossil fuel dependence and deliver a just transition that protects both people and planet. I do think the health community now has a very, very important role, a vital role, because your voices make clear that it is not an abstract debate. It's about the air our children breathe, the stability of our health system, and the dignity of communities everywhere. So protecting health means exiting fossil dependence. That is so imperative in this moment, and that is a signal COP30 must send. Thank you, and thank you for what you do.
Hello, I'm Dr. Jamila Mahmood, and I'm honored to join you for the launch of Cradle to Grave, the health toll of fossil fuels and the imperative for a just transition. The report lays bare what many of us in the health community already know. Fossil fuels are harming human health from the moment they are extracted to the moment they are burned. The evidence is overwhelming. We see it in children struggling with asthma, in families burdened by heart and lung disease, and in communities on the front lines of toxic pollution and climate change. But what this report also shows us is that solutions exist. A just transition away from fossil fuels is not only possible, it is a health imperative. By moving decisively towards clean energy, we can save lives, reduce suffering, and create healthier, more resilient societies. This is why the voice of the health community is so critical. We cannot remain silent. We have the authority, the evidence, and the moral responsibility to speak up. To say clearly, protecting health means ending our dependence on fossil fuels. The choice before us is urgent, but it is also full of hope. Together, we can drive transition and secure a healthier, more just future for all.
Great. Is Bobby still here? Mr. Peak, are you there? If we lost him again.
No, I'm
Hey,
here.
there. Hello. I'm sorry for the technical troubles. Okay, so we wanted to hear from you, drawing on the lived experiences of communities most affected by all the things that we've been talking about this morning around fossil fuel extraction and pollution. What urgent lessons should the world be taking from those realities?
Yeah, so firstly, well done on the report in terms of bringing to the fore the information that as activists who lived next to an oil refinery, 143 meters from an oil refinery, who has experienced death of family members who worked in the chemical industry and lived in the communities next to these oil refineries. I think this is a really important piece of information that comes to the fore that can hopefully direct decision makers to ensure that we have an economy that gives us hope for a just transition and a regenerative economy. And that economy is not the fossil fuel economy. And you can see that from how fossil fuel companies are now just abandoning their toxic operational sites and leaving it to society to clean up or to live, as was said early on, in these sacrifice zones that has become common type of language that we have to sacrifice with our bodies for the greater good of the fossil fuel economy. So I think we're in a point now that, since over 3 or 4 decades, we have clearly indicated and said health is a big issue and it needs to be understood. And I think at a very local level in South Africa, using health information, working with the Public Health Association of South Africa, getting research done by health economists and by academics, we have not only managed to be on the defensive, but also to be on the offensive. And I think this is what's important about the health fraternities. How are we on the offensive to be able to shift and to change practices going forward? So in South Africa, we have managed to put pressure and on the Department of Health to now consider what is the health rate of air pollution from fossil fuels and to take that more seriously. And the research that we have around people's health, around coal-fired power stations, which are reflected in this report, clearly indicate that action needs to be taken. And in South Africa, where we have a situation where our air pollution emission standards are very, very seldom met, and those standards being not advanced standards, it results in air pollution and the air quality for people on the fence line being in excess of guidelines of the WHO regularly. It's a living reality for us. So I think based upon that, we need this report, and we need you as academics, as researchers, to be able to put your voice out there and to make sure it's ahead of the fossil fuel companies, and it's ahead of, I think, politicians who do not see development through the lens of people, but rather see development through the lens of economic profits for the fossil fuel companies. So yeah, I think well done, people. And I'm looking forward to all of us using this report to change policy from a local level, provincial level, to a national and international level. Well done.
Awesome. That's a great segue into talking about kind of where we go from here with all of this information. Dr. Howard, could you talk about why it's important that an alliance of health organizations is coming together with a report like this at this particular moment in time? Why now?
Thanks. So Bobby mentioned that we need to figure out a positive vision of the future that people can work towards. We know what we don't want. And I think the most positive vision that makes the most sense is to start to reorient our entire societies around well-being, around the goal of long-term well-being for all. Because what that does is it changes the equation. We start to develop a new set of metrics. And then we can say, okay, well, is this action aligned with what we actually want? What we're seeing right now is that in a world built around profit, health isn't even part of the equation. And from where I'm sitting as a physician and a policy worker, I'm not seeing the right variables included in the equation, so I don't really care about the answer. When politicians try to sell us fossil fuel development based on the amount of current day tax dollars, which is usually part of it, and current day jobs numbers, what they usually fail to include in the equation are the long-term cleanup costs, the costs of health impacts to the workers. And so really, I think we need to get a lot clearer about what we're all aiming for long-term. And there are countries around the world that have developed metrics for that. We already last year, the WHO Council on the Economics of Health for All, the Pact for Future Generations, we've actually articulated this quite well and agreed upon it as an international community. And so we need to move forward with that. And so what I think the health community brings to it is that we have an evidence-based approach, we're an ethics-driven profession, and we're well organized. We are able to marshal organizations representing over 40 million healthcare professionals, each one of them embedded in a community, knowing the people, having the relationships, knowing the stories. And what we find is that when we come to policymakers and we say, hey, my patients are getting sick as a result of this economic policy. Maybe it seems good to you right now because you're getting tax dollars based on this, but your short-term key performance indicators as a politician tend to be fundraising and votes. Our key performance indicators as a community are much more long-term. They are the well-being and quality of life of our community and that of our children and future generations. And so at this moment, I think that the health community is well positioned to speak in the frame that we know based on communication studies and frankly personal experience is what really speaks to people's hearts. How can we now make decisions that protect our children, that allow us to show that love that we have for them in a tangible way? I think that's reorienting clearly around metrics around long-term well-being for all, and then really making sure we're including the right variables in the equations, the pros and cons, and that means including the health risks of fossil fuels so that we can really say, okay, we actually haven't even had this in our equations. Clearly, renewable energy is the pathway to a healthy future.
Yeah, I know. I mean, so many of the economic models that are being used for policy making too don't include any health impacts at all. It's really shocking. Um, and upsetting, frankly. Okay, so Dr. Nera, what practical steps can the WHO or other institutions, especially international institutions, policymaking institutions, what steps can they be taking now to frame fossil fuel harms as a core public health issue?
Thank you. And I think we have many of the answers provided from previous speakers. One, the health community needs to be very, very active because this is an issue of public health. This is not longer exclusively an issue of economic development or energy ministers or environmental issues or a climate treaty. This is now a public health treaty, a public health issue, and therefore we need to be mobilized as if it was a pandemic treaty or if it was something similar to the tobacco or something related to diseases we were tackling in the past. So big mobilization. One of the most powerful things we did together with some of the representatives here today, the Global Climate and Health Alliance, was to bring the signature of many health professionals to remind everybody at COP that they were not only negotiating with the percentage of emissions of CO2, but they were negotiating with our health. And any decision they were taking, it will have an impact on our health, a positive or a negative one. And third, I think we need to be very smart on the tactics we use to communicate and making sure that the health argument is everywhere. And the health argument is the one that, as I say, nobody can disagree with, and is very powerful, and is the one that we can use with communities for them to put influence and pressure on their politicians. Another one are the mayors. I mean, the local governors, mayors, the people who are very close to their own citizens, and we can provide for them the health benefits that can be obtained when they move to a different sources of energy, different transport. So when they realize what is at stake for the health of their citizens. And finally, I think this initiative of greening the health sector, so the health system, reducing our own carbon emissions, I think is important because it represents 5% of the global emissions, but it's important as well from a symbol point of view because it gets the mobilization of the health sector. It gets very powerful voices around that coming from a very trusted community, which are the health professionals. And of course, we will keep with all the political pressure at the COPs, at the World Health Assembly, at any fora where we can have an impact. We need to keep with that, of course, influence and political pressure, and more than ever recognizing that the health community has a major mission here, similar to the one we have ages ago with the access to clean water or sanitation or nutrition. Now is something that access to clean energy, there are no reasons why we cannot accelerate that, and we cannot bring all the health benefits and visualize them for people to be more motivated.
Yeah. Kind of building off of that, Professor Morgera, could you speak about what levers exist within the UN processes to kind of insert concerns about health? There you are, concerns about health into some of the negotiations that we might see at COP or even at the IPCC level? What are the sort of levers that can be pulled?
Yeah, well, we have several UN spaces where we must bring to the fore the health argument. We know that COP30 is coming. And I think, as I have also explained in my own report, we must have a priority on the phase out of fossil fuels as a matter of most effective climate mitigation measure, but also the most impactful health contributions we can make. And at the moment, we don't even know whether there'll be progress on mitigation, let alone whether we will discuss fossil fuels. But what I have recommended is based on how clear international law is now, including international human rights, and all our human rights are negatively impacted by harm to our health, is to start already a process of monitoring whether states are making progress or not on phasing out fossil fuels based on the recognition of existing international law prohibiting the further expansion of fossil fuels and demanding that phasing out. But in addition to that, there are other spaces. Very recently in Geneva, we had what was supposed to be the last phase of negotiations of a plastics treaty. And it was not possible to make progress on reducing production of plastics, which is linked to, in fact, an expansion of fossil fuels around the world. So we need action at that level as well, because we know that fossil fuels are many steps ahead of us. The industry knew that from decades, that they were causing climate change, and that eventually we would have realized that, even with them withholding the information. And so they already have captured so many policy spaces and for decades also disinformed the public, decision makers, provided solutions that are still allowing for the continued extraction and use of fossil fuels and the continued subsidization. So there's also another UN negotiations on a treaty on business and human rights. It has not possible in that negotiation to speak explicitly about climate change and the responsibilities of all business sectors to contribute to the phasing out of fossil fuels, and crucially to protect our public debates to not contribute to climate disinformation, obstruction, or any exercising any undue economic influence on our democratic processes. And maybe the final part is there's so many spaces where we're discussing advancing renewables, and we need all environmental processes, but also all financial processes. There's a UN tax convention being negotiated that's crucial for climate finance. It's crucial to make sure that taxpayers don't end up paying fossil fuel companies to keep increasing their profits at our expense, and rather we devote sufficient funding both to the leapfrogging into a renewable-based economy and protecting the human rights holders who have already been most affected in their health and other human rights by the fossil fuel industry and climate change more generally.
Great, thank you. Mr. Bassi, what kinds of solidarity and international actions do you think are most urgently needed to support frontline communities in Africa?
Well, thank you so much for that question. I believe, first of all, this report presents the opportunity for everyone, especially in the global north, to understand the impacts that fossil fuel extraction and utilization has on the health of people directly. And it's also for us for the understanding that this is not really ending so quickly as we would wish to see that happen. But in a place like the Niger Delta, the oil majors, Shell, Chevron, ExxonMobil, and the rest, are trying to hand over their toxic assets to local corporations, local companies, and so wash their hands of 70 years of toxic legacies that they're trying to leave behind. Now, so we need global solidarity to stand together against the move by this corporation, also to put pressure on the Nigerian government not to endorse this kind of illegal, almost criminal activity by oil corporations. I'm so happy that some officials of the United Nations have issued a letter recently against that move, that the oil corporation is not allowed to move away without, first of all, cleaning up the mess, without detoxifying the environment, decommissioning and dismantling. And this is a very important point. There's so many oil wells that have been abandoned in the Niger Delta and across the world that have not been decommissioned. They're still leaking, and they pose very serious threat to the health of the people. Some of them are exploding, and and they will just and nothing much is being done. And so we need international solidarity to demand that Mine pits are decommissioned and the environment remediated and restored. And every oil well should be, all the old ones that have lived their lifespan should be decommissioned, they should be dismantled, and all those toxic facilities should all be cleared out and removed. These are the urgent ways that we can have international solidarity that will be very useful. And I should just add that in Nigeria, we have a particular case that requires international solidarity. There's a particular oil well that blew up in May 2020, and it's been in flames, been burning since then in the shallow waters of the Atlantic Ocean off the coast of the Niger Delta for 5.5 years now, burning nonstop 24 hours every single day, releasing, is both spilling and burning. So crude oil is going to the waters, and the atmosphere is being contaminated, and the coastal communities are directly impacted. So we do require solidarity in terms of just people just waking up to this horror that is going on without being attended to.
That's shocking, and also surprising that even as someone who pays attention to climate, things going on in the world, this is the first I've heard of that. That's awful. Okay. Mr. Peak, are you still here? Are you with us? Yay. Okay. So you mentioned before the need to envision, a better future without the fossil fuel industry. Where do you see the best opportunities for starting to do that, or kind of anchoring that vision for a more just future?
I really want to build on Brother Nemo's discussion around Shell. As we speak today, we are facing a constitutional court case against Shell, just about 10 kilometers from me, where our constitutional court is going to rule whether Shell can drill and explore or not. We also know at the same time that Europe has increased its imports of coal from South Africa because it needs extra cooling in summer and obviously extra heating in winter. So how do we stop and build a new economy that is regenerative and that speaks to solidarity amongst people? It has to start with Northern NGOs and with society in the North that has used most of the budget that we have available for climate and CO2, and to start forcing their governments and their actions to reduce fossil fuel use and to reduce it at the local level as well. It is no use of having great solidarity with the South and you pumping in the US and pumping in Europe. So it has to be a situation of changing the economy from the fossil fuel economy to a regenerative economy in the global North as well. And for Southern activists, that is critical, because when we are challenged, or when we challenge our governments, often the comment is, oh, well, you're just a Northern funded NGO. And how do we respond to that? If indeed the case is the North is not stopping what it should be doing, and that is stopping fossil fuels. So I think for us, building a regenerative economy means some hard action in the global North. And it does mean that we have to, through platforms such as the United Nations and other global platforms, start making sure that health and climate is key to every international negotiation. We know that the business and human rights debate out in Geneva is pushing that away. It has to be included. In the trade negotiations, it has to be included. And what is really more important is that we need a just transition fund, a just transition reorganization of global finance to make sure that the Nigerian Ogoni wells are cleaned up, to make sure that alternative economies are developed in Uganda rather than the ECOP pipeline, to make sure that people have local small economies that are functional for them first for the people living there, then for the global economy.
Awesome. Thank you. That is a great segue into a question from one of the listeners here, which I'd like to put to all of the panelists, because it's a question that comes up a lot, and that is, okay, well, the global north, or kind of bigger developed countries developed themselves with fossil fuels. Why are you holding us back from exploiting the resources that we have to do the same? This is like a a perennial argument, and it's a valid one. So I'm curious what you all say to that comment. Yeah, go ahead, Dr. Howard.
Sure, thanks. And I think that the answer to this has to do with some of what Bobby's been talking about. At the end of the day, in order to be able to do that in Canada as a place where we have higher per capita emissions than almost anywhere else in the world, we need to win political battles. And so it almost doesn't matter if most of Canada is totally in agreement. We need to construct arguments and provide positive alternatives that can get politicians elected so that the people in power can start to make transitions to the regenerative economy that Bobby is talking about. And so I think we can have more productive conversations as a global community, transitioning from what should happen to how we make it happen. And I think we need to be really clear that the tactics used by fossil fuel companies include a tremendous amount of lobbying, a tremendous amount of messaging that's often not true, a tremendous amount of influence of data. I think we need to get much better at having very specific tactics within a grand global community to counter those. And what I'm seeing right now is a lot of center-left governments in the global north really struggling to put forward a positive narrative that people can rally behind. If all we have to tell people is don't do what those guys do, that's simply not a motivating narrative or a vision or plan that will generate the type of popular support needed to win those elections, to get the people in power who can then transition. And so I really think that the concept of a regenerative economy, the concept of a well-being economy, the concept of really aligning ourselves around a goal of long-term well-being for all, that's something I, as a mother, as a doctor, as a policy worker, can get behind. There's a narrative that works from the personal to the positive, and that's what I'd really like to see us working on. It's not that we're not trying, but we're not winning the political battles, and until we do, unfortunately, we're going to keep having this conversation. And so let's work on that narrative and those tactics.
If I may come in here very quickly, as an African that lived next to an oil refinery and worked with people daily in toxic, surroundings. The reality is when Africa looked at the telecommunication system of the world, did Africa decide to put down copper wires across Africa to connect with each other? No, we didn't. We said, no, that's old school. That's US and Europe old school. What did Africa do? We leapfrogged into cell phones. We even started cell phone banking in Africa. So I think the reality is that we don't have to go down a route that is old, and we need to be careful that we do not allow the North to dominate and to monopolize the future global alternatives economy. Because the longer we wait to move, the less chance we have of protecting people on the ground with regenerative economies.
Can I come in?
Please go for it. Yes.
Very quickly, but a few months ago, we had in Cartagena de Indias in Colombia, a very important global conference on air pollution and health. Because again, I'm convinced that health can be the way to move this mountain on a faster way. So at that meeting on the pollution in Colombia, one of the presenters was the Vice Minister of Health from China. And he made a very powerful presentation about how, through interventions, they are decreasing air pollution in the big cities in China. But my favorite, the most beautiful of those slides for me, the one that I'm using now very often, it was a slide where you could see that in China, they were reducing air pollution while they were still increasing their GDP. And I think this is the type of message that we'll told to politicians. I mean, no way you can decrease the pollution while still protecting your GDP, while advancing on the different sources of energy, renewable, creating new jobs through these sources of energy, and a big economy and a big population like in China. They realize that they cannot have good business if the cities were polluted and the people couldn't breathe. So I think that slide is a key and then maybe a tool that we need to use more often when we discuss with politicians and with our citizens. Of course, they need to benefit the local populations from some resources they have, but while ensuring at the same time a good transition. I'm from the north of Spain. I grew up with on a city that it was horribly polluted because of the mining coal extractions. And everybody was saying, yeah, but the economy is going so well. Well, many years later now, or a few years later, the population is healthier because they are not breathing all of those particles that they were breathing before, and black carbon and everything. And the economy is better than before. So come on, there is no price like destroying the health of our people that can be used to advance on the economy. Look at the health problems we have. We need to react, and we need to react with the ambition and the speed that only public health will require.
Yeah.
Thank you.
Yes, Mr. Bassi, please.
Right. On the question about, the political question, why wouldn't you allow countries who have not polluted to pollute some more? I mean, to catch up with the pollution, more or less using fossil fuels to develop or to catch up. It's a very, very interesting political question, because politicians in Africa use that argument. Africa has a right to develop using fossil fuels. On the face of it, it's very hard to contest that kind of position, seeing that this is what the global north did to a large extent. But the truth is that the expansion of fossil fuel extraction in Africa is largely not to benefit the continent. It's not to develop the continent. It's mainly for export. If you check the map of infrastructure in Africa, everything is going to the seaport. You have the export terminals in Cabo Delgado in Mozambique, you have export terminals in Nigeria, export terminal in Senegal. Everywhere is the appetite for fossil fuels in Europe, North America, and some other places that is driving the expansion. So when politicians say we have a right to use fossil fuel, it's just a way of shifting focus from the structural problems that is driving inequalities in the world today. And so fossil fuel should never be used as an excuse. And as Bobby said, of course, we don't need to, no country needs to get stuck in the oil pit or mine pit, coal pit, for the sake of development, because there are much better ways of doing it. And then even renewable energy, the conflict we're seeing in Congo, Democratic Republic, some of it is about maintaining the mine pits for coltan, for all those minerals needed for so-called critical minerals. Even the language should disturb us. When they call them critical minerals, it means, look, don't stop us from moving. Otherwise, if you insist that this, if you say we don't extract it, it means we are losing something critical. No, we're not losing anything critical. We need to look at the health of the people globally.
Yeah. Yeah. Professor Morgera, did you want to add anything on that?
Yeah, I think, well, very much echoing what everyone says, maybe just adding the human rights dimension. Everyone has a human right to development, but that right can't come at the expense of other human rights, our own human rights, or anyone else's human rights. And so it's very clear across all human rights experts that the human right to development can't support an economic model that clearly goes against environmental sustainability and leads on a very clear scientific basis, both environmental and health, leads to harm to our climate system and life supporting system. And now the International Court of Justice has clarified that. In my own report, I argued that defossilizing our economies is a precondition for protecting our human right to development, to a development that is healthy, that protects everyone's human rights, and in that sense also leads us to look at that the root causes of economic inequality. And to me, it just so game-changing to think how we have now clear reports showing that 10% of the world population, the richest of the richest, they emit as much greenhouse gases as the rest of us do in our lifetimes, and they do so in an hour and a half. So clearly the problem we're looking at, it's a problem of very rich elites, mainly in the global north, but not only. And they also have, they can't be calling the shots on everyone's right to development either, because that comes at the expense of our choice. Do we want a life where we have plastics and toxins in our brains, in our reproductive organs, in our children before they're born? This is not a life that most of us want in the first place, and it's certainly not a human right to development. But it does lead to another point that maybe we haven't yet touched upon, and I saw raised in the question, which is fossil fuels and other allied economic interests and actors are also active in the context of renewables and in the search for critical minerals. And we have to be very careful that those demands for energy in any form are not feeding back into the same economic model that's inherently and irreconcilably harming our health. But we have the information. We must need all democratic processes. We need all the education as well to be able to follow the trail of that fossil fuel-based economy and the excessive energy demand economy, which makes us all worst while.
Yeah. Yeah. I find it frustrating how frequently this right to development thing gets used and how infrequently we talk about how easy it would be actually for the global north to reduce consumption. You know? I don't think anyone would even feel it. We could do it. Okay, I want to ask, especially Dr. Nera, if you're still here, but all of you as well. I spend most of my time following right-wing weirdos around the internet, seeing what they're talking about on climate. And one thing they've been talking about for a really long time is how worried they are actually that people will figure out that dealing with air pollution and dealing with water pollution and things like that are actually a way to get climate action without talking about the atmosphere and parts per million and all of those kinds of things. So actually, for a really long time, there's been quite a lot of conversation within these circles of, how to defend against discussions of air pollution. And I'm curious what you think about that and why you think it's taken people who do want climate action and who do want to see a just transition so long to actually push that argument more. Why aren't we seeing it more from climate people? In fact, even I sometimes see climate people criticizing folks for talking about air pollution instead of emissions. So yeah, I'm curious for your thoughts on that. Yeah, please, Dr. Howard.
I can answer that because I've been involved in curriculum change efforts in the medical societies for about 15 years. And the reality is the doctors didn't know, nurses didn't know, pharmacists didn't know. And that has to do, I did a landscape analysis last year for Canada. And the biggest gap we identified was that it hasn't been in curricula, and the International Federation of Medical Students Associations did a global survey not long ago and found that only about 20% of learners were being taught about climate change and air pollution. And when we tried to figure out in Canada how that situation had persisted for so long, basically the number one problem was that senior leaders didn't know what they didn't know. And so because they controlled the agenda, they weren't putting it on the agenda. And so then it wasn't going into curricula. And so that left medical learners trying to advocate up through the medical hierarchy. And that is a very difficult thing to do. And so that I now know is the situation pretty much globally. I've seen similar patterns in economics education as well as in engineering education. I've done formal work on that. And so we're in this place where the people who are most powerful within our most potentially good and helpful professional groups just don't know. So we are making progress. At COP 26, we did manage to get over 50 countries to sign on to climate resilient low carbon health systems. That made it way easier in Canada to get all of our medical communities and faculties to sign on to a declaration of planetary health. And actually on October 6th, we're finally having our first National Day for Planetary Health. We're organizing an in-person gathering. We've got the presidents of the colleges, with the presidents of the medical associations, presidents of the nursing association. So we're getting there. We are ready. We are revving up, and we are ready because people understand once they look at a graph, it's a matter of getting their attention in the face of competing priorities. So we are coming. So get ready, guys. We are ready to mainstream this argument.
Yeah. You guys had a picture in the report of like a healthy lung, the lung of a 14-year-old boy exposed to air pollution, and then a smoker's lung. And I was like, damn, this is so compelling just seeing this. Like that, and I think it's very easy to make the argument that like that kid should not be dealing with that through absolutely no choice that they've ever made. It's such a powerful argument. So yeah, I hope that all of this evidence goes into it. Yes, Professor Murjar, please.
Yeah, I mean, maybe another thought. I think there was good intention when we created the global climate regime to focus on carbon and emissions, thinking, okay, this is effective, it's measurable, it can help us hold states and companies accountable. Unfortunately, it has been captured and it hasn't quite served that purpose. What we've lost along the way is what we knew all along, that the climate system is part of nature and nature is regulating our climate. And so what we've heard now, both from the International Court of Justice and the Inter-American Court for Human Rights, is that protecting the climate means protecting all life-supporting systems on our planet. And we know that that's also why it's so important to have the health evidence to make all of us aware, whether we live in a more connected way with nature or not, that all aspects of our human well-being are dependent on healthy water, healthy food, healthy environment. And really that's, but the challenge with that is that, of course, all our public authorities everywhere in the world are structured in sectors. And we discuss separately our water systems from our food systems, from our climate system and nature protection, and from our health protection as well. So there is a lot of joined up action that we need. And again, the health evidence shows that that's what makes the most sense. And so also importantly in our transformation towards renewable-based economies. And when we're going wrong with renewables sometimes is that we don't make decisions at that nexus of health, nature, food, and water. But we know that the science and the lived experiences of people's align. They show us what's the healthier path. And we have to choose it, even if are all separate policy objectives of safer climate, better health for everyone, protecting nature, protecting our water courses.
Yeah. Yeah. We have 1 minute. Does anyone want to say one last thing before we release people to the rest of their day? Bobby, yes?
I would say we're winning, right? So we have I would say we have the ICJ case. We have stopped, there's no more coal in the future of the South African energy system. I know that with Comrade Nimmo and people in the Delta, they are stopping oil wells. They're not only fighting back and losing. Thank you. And because of health, because of you guys.
Love it. All right, awesome. Thank you all so much. Everyone go download and read this report. It's amazing. And thank you for putting it together. Thank you.
Thank you.
Thank you, everyone. Lovely to meet you.